Dr. Noelle Lee. I am a family medicine physician at Root Family Medicine in Norwood, Massachusetts, and I am a DO, which means Doctor of Osteopathy. So I practice full range family medicine, infants to geriatrics, but I also do hands-on osteopathic manipulation, which is a very gentle technique that just helps your body realign and function better, often to get out of pain, but also, as I'm going to talk about today, it can help move circulation and move your lymphatics, which is what we think helps boost your immune system. So there is a long-standing osteopathic history of our patients in the 1918 Spanish flu epidemic having a much better survival rate than people who did not receive osteopathic manipulation. This is something everyone who's been through osteopathic school has been taught every time we learn a lymphatic technique. The numbers are there, they are not case controlled. Is this scientific? Who knows? All we know is this is the history that was passed down to us. And these lymphatic techniques are wonderful for you, are completely harmless. So at the least, we won't have done anything wrong. So I wish I could come out there and treat every single one of you, hands-on, myself. But right now, we're on social isolation and I can't even treat my own patients. So I'm gonna give you a few methods that you can do on your own that will help move your lymphatics without me moving them for you, okay? Very simple. Breathe, walk, bounce, right? So I do have a separate video on deep breathing that I highly recommend you take a look at. And that will give you like the full 7 minutes of how to do a nice deep breath. But the short version is, when you breathe in, put your hand on your belly. You want to breathe all that air in so that you're expanding your belly out. If you can breathe through your nose, that's ideal. If you're congested, do it through your mouth, it's fine. So you're breathing in slowly, filling up your belly, and very slow exhale out your nose if you can. Constricting your belly back in on the exhale. And then the other piece of this is you breathe in and you fill up your belly, and then you also fill up your ribs, expanding all the way around and into your upper chest. So one nice deep breath looks like this. Breathing out and breathing in. Okay, I'm going to show you this from the side, but first, inhale your shoulders up and exhale them back down and shake them out really good, because what you don't want to be doing is this, right? Shoulders don't help you breathe. There's a very slight shoulder movement as you breathe in that's a result of you expanding your rib cage, but you should actively be moving your shoulders. Okay, so let's try this again. Breathing in. And exhale. And so when you really get that nice, loose, deep movement of your diaphragm, it helps your venous and lymphatic drainage come back to your heart. And so it's circulating it through your whole body a little bit faster and more efficiently. And the side benefit of that being, we also know that it helps anxiety and helps your nervous system calm down. So highly recommend deep breathing. Again, check my other video for that. So the other thing that is well recognized in medicine to help move your lymphatics is any kind of exercise, because any kind of calf muscle pump, and actually any muscle pump in general, but especially we do think of calves moving because it pumps it all the way up from your feet, helps, again, increase that venous return, increase that lymphatic return. So here's a couple words of advice I have on actually how to walk. And something that's really important is not just the calf muscles, it's like it's this crosswise movement from one side to the other, and it actually rocks your hips and rocks your sacrum and makes your shoulders move, and so gets this lymphatic pump going in your whole body. So what you have to do is think of yourself as a runway model. Have you watched them walk lately? It's such a beautiful fluid motion. So when you're walking, you want it to look like this. Obviously, you can speed that up. But you want to swing your hips, you want to rock your shoulders, you want to be really loose through your whole body. Because the looser you can be, the more movement that you get all the way from the tips of your toes up to the top of your head. So give that a shot. Walk around your house for a second, right? And obviously, you know, if we're out walking, we're going to do this a lot faster. I know this looks silly, right? But if I did nothing but make you laugh today, we're good. So when you're walking around, you just have to make sure that you get this nice swinging motion of your arms and your hips. So ideally, not holding a water bottle or not having a backpack on. I mean, we do the best we can. But even if you do, try to make sure that you get that shoulder motion in and that you get that hip motion in. Okay, so walking 101. Do that. That is good for your lymph. Walking is exercise. Walking is great for everything. Make sure you get outside and get some fresh air if that is at all possible for you. Okay, so number 3 is bounce. So again, when we bounce, we're using our calf muscles, so that helps. But from an osteopathic perspective, we're always trying to get some fluid motion and fluid fluctuation into the system because it cleans out all those dusty corners of our bodies. We want to get circulation to every little corner that we can get it to. So you can stand on the floor and you're going to come up on your toes just a little bit, like just an inch or a half inch off the floor, and just relax your knees, relax your hips, relax your shoulders, and just bounce. And so you should get a little bit of motion in your hands and in your shoulders. Now, and actually what I would recommend you do is set a timer for 1 minute and do this a couple times a day. It feels kind of good, actually. Again, if I did nothing today but make you laugh, like we're in good shape because laughing moves your diaphragm and that helps move your lymph. Yay! So if you have a trampoline at home, you can get even a little bit more motion in here. So mini trampolines are great because really the motion you want to get is a teeny tiny motion. It's these very subtle micro motions that really help the lymphatics move. So even on a mini trampoline, you're only just coming to your toes. My heels are actually still contacting the surface of the trampoline. And I'm just using my toes to, again, relax my knees and just get this very, very tiny bouncing motion. Relax the shoulders. And you want to feel that all the way into your neck and your head. And again, set a timer for a minute. Do this a couple times a day. Even if you have mild cold symptoms or mild illness, as long as you feel well enough to do it, then do it. Now, if you have a big trampoline in your backyard, you can also do this on a big trampoline, although it's a little harder to get the micro movements on a big trampoline, but you absolutely have to be the only person on the trampoline and be right in the middle. And again, like, it's just this tiny little rocking motion. There's nothing wrong with jumping if you feel like jumping, but specifically for lymphatics, so see what happens when you jump is you tense up, right? So it's a different thing that's happening. And again, well, is this scientifically studied? No. This is just my opinion. This is what people think who think about lymphatic motion. It's this tiny motion that really, and you keep doing it until you can feel just that fluid fluctuating from the top of your head to the tips of your toes. So 3 things today: breathe, walk, bounce. self-osteopathic treatment for your lymphatics and your immune system. I will have another video coming about rib raising, which is a way to get your whole chest and rib cage moving. And it's a technique, a very simple technique you can do on a family member who might be experiencing some symptoms. That's very safe. So stay tuned for that one. But for self-treatment, give these a shot.